Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Can an ambulance refuse to take you to the hospital? The short answer is yes, but it's not a simple decision and it's governed by strict rules. Paramedics and EMTs operate under specific medical protocols, and their primary job is to provide the right care for your situation, which doesn't always mean a trip to the ER. Let's break down the main reasons why an ambulance might not transport you. First is the issue of medical necessity. If you call 911 for a minor issue, like a small cut that stopped bleeding or a common cold, the paramedics will assess you. If they determine your condition is not a medical emergency and you are stable, they can refuse transport. They are an emergency resource, not a taxi service. Transporting a non-emergency patient could mean they are unavailable for a true life or death call like a heart attack or a major car accident happening at the same time. The second major reason is your right to refuse. If you are a mentally competent adult, you have the absolute right to refuse medical care, including a ride to the hospital. Paramedics cannot force you to go. They will, however, strongly advise you on the potential risks of refusing care and will likely ask you to sign a form called a refusal of care or an Against Medical Advice (AMA) form. This document states that you understand the risks and are making an informed decision to stay home. Third, there's the issue of safety. If a patient is extremely violent or combative and poses a direct threat to the safety of the medical crew, they may wait for law enforcement to arrive and secure the scene before they can safely provide treatment or transport. Another related question is, can you choose which hospital they take you to? The answer is usually no. Ambulance crews are required to take you to the closest appropriate hospital. If you're having a major stroke, they will bypass the small community hospital 5 minutes away to take you to the certified stroke center 15 minutes away. The same goes for trauma centers or cardiac centers. Their destination is based on your medical needs and regional protocols, not your personal preference, although they may take your request into account if there are multiple appropriate options nearby. So, what should you do if you believe you need to go and they disagree? Clearly and calmly explain your symptoms and why you feel it's an emergency. You can also ask the crew if they can contact their medical control, which is a doctor they can speak to for guidance. Ultimately, paramedics are highly trained professionals making decisions based on your health and the well-being of the entire community. Their goal is to get you the right level of care, and sometimes, that care doesn't involve an ambulance ride. Thanks so much for watching. If you found this information helpful and want to learn more about how emergency services work, please hit that subscribe button and give this video a thumbs up. It